today we are so excited to bring our wonderful marketing specialist to you. Val Tarver is joining us today for a conversation about health access and also pursuing a diagnosis. Welcome, Val.
Thank you so much. I'm really excited to be on you guys' show and just to share my story.
That is so awesome. We are blessed to have you in our lives and to have you here today. Thank you so much. So, one of the things that I wanted to just dive in with, so you all first, I'm like, hi, I'm Christine Bowen, and I'm one of your hosts. And then also, this is my sibling, Em Bowen,
Hi
and they
there.
are also one of our hosts. So, good morning. Let's go ahead and get cracking. And really, one of the questions that I have for you, Val, is if you could share a little bit with us about what it's been like as you've been pursuing answers for what's going on with your health, or like you've been on this health journey. What has it been like for you when you've been seeking medical help?
Well, with my background, as of right now, is mainly hypertension, um, pre-diabetic. We're gonna say pre. I haven't reached that threshold yet, but as far as the symptoms of hypertension, it could be pain, especially if you're having a mini stroke, what we call a TIA, which I've had three of those. And so sometimes you call your, you go to the emergency room because you're in extreme pain, and the over the counter strength is just not working. It's just because your blood pressure is not going down for some reason. And so you go to the emergency room and you let them know that you're in extreme pain. They do the traditional on a scale of 1 to 10, how severe is this pain, and you let them know. And it's almost a waste of a question, because once you tell them, the severity of your pain, it's almost, you can see it in their eyes, like they don't believe you, for one, or it's almost, well, you can handle it. What we'll do is we'll just give you what you said you've already taken over the counter, and that should help. And so I see, not to assume, but you almost feel like a criminal going in, as if you're there lying to just get drugs. And if anyone knows me, I don't even want to be on the hypertension medication that I'm on, because that is actually one of my fears. And that's why I seek out natural remedies, because now you see a lot of people who take multiple drugs and then they end up it conflict with each other, and they end up dying from the result of that. So I am fearful of medication. So if I go in and say I need it, I'm not there because I'm an addict. It's because I need it. Because the pain is so severe. But to be treated that way, you almost don't want to go in, which is dangerous with someone that has hypertension. But the experience is even more painful to have to go through. You're dealing with the pain, and you're dealing with whatever may be the situation at that moment, whether it's a mini stroke, which I've had many of, or whether it's an illness, whether it's COVID, whatever it may be that you go in for, you have to deal with that along with how you're treated. And it's too much. It's actually too much. So it's been a bit frustrating for me, as far as my journey of finding the right practitioner to treat me. So.
Yeah, to say the least, this sounds like you've been subject to medical trauma where all you're trying to do is get help, and then you're
Yeah.
treated so poorly, and then maybe completely neglected too in
Mhm.
that situation, which could be deadly dangerous.
Yeah, and the thing about it is, it's an easy solution. Trust me, I understand. To not think that there are not addicts out there, it would be naive. That is the case. But there's easy solutions to this, because if I come in, take a urine test, see if I have, drugs in my system, and if that's not the case, then don't assume that I'm an addict, right? Especially if my history doesn't even
Yeah.
show that.
It's almost like a totally different conversation when you're asking for help for your blood vessels in that moment. And they're like, but, how about pain meds and your desire for pain meds? And was it headaches that you were having when you were having a mini stroke?
No, this is pain in the body, like the neck here.
Okay.
It's almost as if you're having a full stroke. And so certain side of your body just freezes up, but sometimes it can be pain, stiffness, too as well, a throbbing in the neck. Sometimes it can be headaches. In my situations, that's not the case unless it's very severe. Um, but yeah, it's mainly in this area, the neck area here.
That's so
And
scary to be in that place where you're so vulnerable and to be begging for help and having
yeah,
them like not able to see you at all.
yeah, and you have to explain, explain, and you're in severe pain, and it's just like I can't keep answering the same questions because you're trying to catch me in a lie or whatever.
Oh,
I just
that's
need whatever you
ridiculous.
have. I don't care if it's a magic wand that zips you and get rid of the pain. It don't have to be a pill. Just do something,
Do
you
something to
know.
help me. And that's all you were asking is do something to
Yeah,
help me. I'm in an emergency. That's why you go to the
absolutely,
emergency room. I am in an
absolutely,
emergency and I need you to behave like it's an emergency.
absolutely. But it's more so the trial, basically, and you're guilty until proven innocent, and really you're never proven innocent because they've already made their assumptions when you walk through the door. Um, yeah,
This is inherent prejudice in medicine, and I feel like I see it so often where women, but especially women of color, are unable to get the help that they need. And it's almost like the system can't see us at all. Like they're looking at us, we're asking for help, they can't see us. And so then we don't get the help that we need, and that results in people dying.
hmm yeah, and
Or
it's not.
living in pain and not getting help and support, right?
Yeah.
So
Yeah,
there's something very concerning around medical health equity for all people. And
yeah,
then, yes, especially women, and then especially Black women, Indigenous women as well.
It's so true. So when we look at things like autoimmune disease, so autoimmune disease is something that we specialize in our program, but there's a lot of overlap with kind of vague symptoms, right? That there could be rashes or some hair loss or some fatigue. And a
hmm
lot of those symptoms could potentially, excuse me, could overlap with autoimmunity. And
hmm
so when we look at trying to help people get answers, it's almost like you have to become your own provider, which is ridiculous that we're in this space. Sorry. Where you have to become your own provider. But it definitely feels like that's what's being demanded of us when dealing with the medical system. So, like you were saying, you are well educated about your own medical condition.
hmm
And so it might be important that you have a little, this is going, again, it puts the onus on the patient, but it might be good to have a little sheet that says, this day TIA, this day TIA, like your medical history in a nutshell that says, hey, I've been having mini strokes for the last
hmm
few years. Do you want to take this seriously? You know,
exactly. And it's not like they don't have your history there because they're looking at your chart. You fill that out before you even go back, but they still take that information and come up with their own conclusions. And based on bias, based on maybe lack of education, you don't want to automatically assume that it's sexism or racism. Maybe it's just um,
maybe they're
how
just a
they
terrible
communicate.
provider.
Yeah, that could be it, or education too as well. You got to think about it that curriculum doesn't change as fast as we think it does, and so things that was established maybe decades ago are still being taught. So misinformed. And but I think just as we have learned to become our own advocates, I think medical practitioners ought to also challenge the status quo and say, maybe what I believe for so long may not be right.
Yeah.
Maybe I need to add some things into my arsenal and maybe relook at some things that I thought were helpful to my patients that may not be, or relook at some biases that I may have that are maybe unconscious bias that I don't even recognize that are there, and just go from there. Just remember, I remember one time I volunteered at a clinic, right? And this clinic had medical students that were supervised by actual licensed medical practitioners. And they were overwhelmingly excited. Their bedside manners was awesome. They were attentive. And what I think, outside of bias, let's just take it generally, they go in medicine for the right reasons. And
They want to
then
help
I think
people.
they want to help people. And then once they get into the machine and making the money and having the things and want to climb that ladder, there's a hardness
Or
that
seeing 60 people a day for 10 minutes apiece,
way,
does that
and
like beat it out of them?
it beat it out of them, and it shows, and you feel like a number. They don't even hide it well. And this is your life, you
Mm-hmm.
know.
It's
This
so
is
true.
your life. So this is not a product or a game or something that you're purchasing, but you're playing with my life. It's life and death. And to me, you're taking it as a number, and that's frustrating. Um, so
That's so true. I feel like one of the pieces that we had talked about in the past that maybe some people would be surprised to hear, but most people would not be surprised to hear, is that a lot of the curriculum, like you were saying, is not updated. And so even something like skin conditions on people of color, like I didn't learn any of that. In general, it was like every single slide was a white person except for learning about keloid scarring. And that was it. That was the only time that we saw skin of color in our dermatology class. And so then we have to take it on ourselves as providers to continue our education or learn about the implicit bias that exists and make sure that we're aware of it, because then we can make sure that we're not behaving in these ways that really leave people out in the cold. Em, I'd love to hear what you have to say.
Yeah, I was just going to say that this is one of the reasons that I really like working with you, Christine. I see you as somebody who is super curious. And so, yes, you've kind of ended up with the specialty around people with digestive issues, inflammatory conditions, and autoimmune conditions. But I see you as somebody who, when you hear about something new, or somebody presents you with new symptoms that you maybe haven't seen in kind of that constellation before, it inspires a curiosity in you. And so I think there are other practitioners that do this like you, but I think it is one of your superpowers is you're excited to find the information that helps the people versus fit the people into the buckets that you find easy to diagnose, right? And then if they don't fit, I think a lot of practitioners do this. If you don't fit into the things that I see all the time or have had success prescribing for, then sometimes we just assign that those people are making it up, or we just don't have the energy for them or the curiosity for them. If I didn't hear about this in my book, I don't feel like I don't feel empowered to help you because I don't know how to help you. If people have a lot of ego investment in that,
This
then they
is
kind of stay where they are. Whereas I see you dive in and go, what do something I don't already know yet. Let's discover, and let's discover it really championing the patient rather than making the patient wrong because I don't have a quick fix for them.
this. I always say to my patients, "You are the resident expert in your body. Tell me how it feels."
I was just about to say that. And like I said, we're not trying to challenge your education. Lord knows you go to school for a long time. But I have lived in this body
Yes.
for
Yes.
my whole life. And I know when something is not right. I may not have the education to know what is happening. But and at this point, if you live with an ailment for so long, you almost know what is happening if you've had that illness for so long. Because with my hypertension, I almost know, I could almost tell you without putting a
The cuff
drop,
on.
how high my blood pressure is based
Yeah.
on if I'm slurring my words, if I'm if my eyes, my vision, I can almost within a range of 10, give or take, tell you what my blood pressure is, you know? And so that comes from living with high blood pressure since I was a young adult.
Wow. And being that resident expert. So that's one of the things that we wanted to, give you a few little tips today, listener, because the three of us have tried to learn our own ways of getting our needs met in medicine. And so some of the things that we see can help is one, recognizing your power of being the resident expert in living in this body. Know that if something doesn't feel right, that is exactly all you need to be able to continue pursuing answers, even if people are closing doors in your face.
Yes.
So I consider that like being the squeaky wheel and just continuing to demand that somebody pay attention to what's going on with your health, and things like knowing that you can choose another provider. Like just because you've been assigned this provider or you picked them 4 years ago, if they're not working for you, they're out. You know, find somebody new, look at their bios, see who might resonate with you, who has kind of similar life outlook or anything that's overlapping or something that you can even really bond on. I know it's hard to bond with a provider in 10 minutes. One of the other things that I would say is seeing nurse practitioners and physician's assistants. Sometimes you'll get more personalized treatment than when you're seeing MDs. And so if you can have a relationship with a nurse practitioner or a physician's assistant, then that's really like the inroad to being able to have better care from your MD. Even if you only very occasionally check in with the MD, you can get better care from the PAs or ARNPs. And if your area has licensed naturopathic physicians, we definitely would like to say that we think differently. We're looking for the underlying cause. We really want to ideally manage your condition or help you to ideally manage your condition instead of just barely managing it, which sounds like, Val, what you've been subject to. Yeah,
I was just going to say, like, maybe you can share with people who haven't heard about working with naturopathic or functional medicine doctors, um, what that difference is in how much time you would spend with me on a first appointment or follow-up appointments. Because when you were saying that my MD might spend 10 minutes with me, usually it feels like 3 to 5 if I'm lucky. So if I don't
yeah.
remember everything that's been going on
Yeah.
since I last saw them, like I
Mhm.
don't have time to even just like think like, oh, another thing that I was concerned about, because they're gone before like I have time to remember that I want them to check out some other part of my body that maybe isn't as flared today, but was concerning me last month, right? That 3 to 5, maybe 10 minutes on a generous day isn't a lot of interaction, and I feel like what you do is different, and I want people to know about that.
Definitely. So, naturopathic doctors, we're all a little bit different in how we practice. But for me, my first office visit is 90 minutes because I feel like you only can scratch the surface on what's going on with somebody's health in 3 to 5 minutes or 10 minutes. You're never going to get quality of care when you have this really strict time limit to how long you can talk to somebody. And some of that is like you're on the spot, you might not remember. So this might be a good reason to have that little written up thing that you take in with you that has your 4 questions, and you start your conversation with, I have 4 questions that I need to have answered today.
Yeah. I think a lot of people too, um, I think everybody practices biases, whether you are the patient or the doctor. Let me explain, because I think a lot of people watching can actually relate to this, and maybe you can provide clarity. I think a lot of reasons they want something different than what they've been receiving from the traditional MDs, but then they're scared to go outside of that. Let's say to naturopathic because they feel like, okay, am I going to be able to use my insurance? Right?
Yep.
You know,
It's a
is
very
it going to be
valid question.
what the out of pocket? At least you kind of know, you kind of stick with the evil you do know. I do know they don't provide the
Yeah.
best service. You know, I can use my insurance, and I can only pay, this copay, and you kind of know that. But when you're dealing with alternative medicine, or you're dealing with a different type of physician, you don't know how that's gonna look as far as cost. And being a entrepreneur, I don't have the worst insurance, but I don't have the best as if when I was in corporate America. And so those are some of the concerns too, as well, as far as cost and affordability. And are you able to use traditional insurance with different type of practitioners?
Yeah, that's a great question. And so, if you're in a licensed state for naturopathic medicine, then you may be able to use your insurance for naturopathic doctors, or things like acupuncture, massage, even like physical therapy or chiropractic. So some insurance companies do have those types of plans. Sometimes insurance companies or your employer, or maybe even if you're self-employed, you might have a health savings account or flexible spending. Then money like that is at least pre-tax dollars that you would be able to spend on those health expenses that are outside of what insurance covers. But there also are things like schools. And so, like Bastyr University here in Washington, you can get really affordable care if you're willing to go to the student shifts with maybe the people who are very excited about being in medicine for the right reasons, or like a massage school in your area, or an acupuncture school where you can get really low cost, sometimes like community acupuncture or other things like that. So those might be really good resources if we have limited insurance coverage or limited resources for affording those things outside of insurance. And then one thing that I would have people know is that when your doctor orders labs, sometimes those labs are 3 to 5 times the actual cost of the labs. And so then if your insurance doesn't cover the labs that your doctor ordered, then you'll end up paying the 3 to 5 times higher price for those labs. So that's why I fully support some of these online systems that allow patients to self-order, self-pay for labs, because you'll be paying the 1/5 rate instead of potentially 5 times the rate later on. And so at least then you know, like, oh, this panel is $140 and it includes these things. Is this something that I can budget for? And I feel like anymore, medicine withholds testing. Like, you'll get 2 tests, and like for you, Val, you should be getting clotting cascades and all sorts of other things tested when you come in with those symptoms. You definitely should be getting like a full lab panel and all of the medicine that they can give you in that moment to make sure that you're safe. But instead, we see that insurance companies really are deciding how much or how little testing can be ordered because they don't want to spend money. It's bad for their bottom line. And so then people are hurt because they are not able to get access to testing, or their diagnosis might be delayed. And so we, Immune Recovery, we even host a link for self-order, self-pay labs. And so we'll make sure to share that in the show notes.
Awesome.
One other thing that we wanted to put out there is the power of community. So, Em, I'd love for you to talk a little bit about the power of community.
Yeah. We have focused a lot when we're working with folks around a lot of our diagnoses, especially if we've been on this long road to get acknowledged and get supported, can be isolating. And we find that it's really important for folks to have other people who've gone through it, so we can share resources with each other, so we can stir hope in each other, so that we can listen and be seen, heard, understood, celebrated. When I say resources, resources might be saying like, my doctor put me on a new medication that's really effective. Maybe other folks want to go ahead and talk to their providers to see if this is a possibility, or maybe I've got some sort of treatment for topical treatment for my skin that's helpful or effective. but also just, maybe it's recipes, like, oh, I'm trying to eat in an anti-inflammatory way, and people are going to share recipes of some of my favorite foods that make it so that I'm resistant to changing the way I eat.
You were saying community can help us when we're feeling isolated, or even like sharing information, right? If people
Yeah.
feel like their providers aren't giving them any information, they don't know where to get information, being in a community where you have like free sharing of information, I feel like that can be so empowering when you're feeling powerless in your own health journey.
Absolutely. Plus, there is, when you're in a community, then again, we get new information, right? And we get to disseminate it. And so there's that benefit of, if when we see research that ties gut health to autoimmune conditions, right? We get to share that. We get to see, like, oh, people are starting to look at this, or looking at natural medicines and treatments that can help. Because it is a big pivot to change your lifestyle to really address things, and be on top of your health. So yeah, we want people to have community. We don't want it to be like lots of individuals trying to do it all by themselves.
Absolutely. Absolutely. Well, this has been a really interesting talk, and I feel like we have a lot of work to do. People in medicine, it's a challenge to all of us to do better by our patients, but then it also is an opportunity for patients to take some of their power back and know that you shouldn't have to be the one who's driving the bus when it comes to your health. But I think that it's really important that you know that that power is yours, and if people aren't working with you, move on until you find somebody who really resonates with you and you feel like you're making progress with.
Absolutely. Thank you so
Thank
much.
you all. You have a great day, and we look forward to talking to you more again soon. And then Val can be found on her LinkedIn, and we'll make sure that we put her LinkedIn in our show notes as well. Thank
Thank you
you
so
so
much.
much for joining us. Bye, everybody.
Bye,
Bye.
everyone.
Bye.
Please subscribe to our channel and hit the notification bell to be notified when we post new content.
Make sure to follow us on Facebook and other social media.